Hi everybody, Dr. Susan here. I just wanted to make a quick video today on an epidemic that's going around our country. It's called diabetes. So you might know, I don't even know the numbers anymore. They're changing so rapidly in the wrong direction, but I see it all the time in the office. People with diabetic blood sugar numbers are coming in and they're not being told their medical doctor. So 75 to 85% of the diabetes that's happening in America is completely reversible. So, but you first have to know what your blood sugar numbers are, and you have to know the levels that they should be. So that seems to be the problem today. So the old values used to be that any blood sugar over 100 was pre-diabetes. It was considered pre-diabetes. You'd be told you have pre-diabetes and you better start watching diet and things like that. But honestly, the American Diabetic Association's diet is incorrect, and I have reviewed it, and it will not change diabetes, unfortunately. It will not change what's happening in today's world. So the doctor may have told you back then, if your blood sugar went over 100 and they diagnosed you with pre-diabetes, some things to do. If blood sugar numbers went over 120, that's when you were diagnosed a diabetic and put on medication. What I see today going on is just insane, because I have people come in with blood sugar numbers of 140, 150, even 160, and they're not even mentioned, not even told anything about diabetes. So it's really scaring me, because the things that happen as a repercussion of diabetes, like, people are just not taking this seriously enough, that you have to make sure your blood sugar is in the right values, the correct human physiological values. You have to make sure that they are there, because don't depend on your medical doctor to mention it to you, because it may not happen. So very often they do blood work, but I have a patient, she was actually in today, which is funny because I was going to do this video, and she keeps sending me blood work that the doctor is doing on her, but he's leaving out her glucose. He doesn't measure her glucose. In fairness to him, he measures hemoglobin A1C once in a while, which is a better marker, but he never measures her glucose, and he never measures her triglycerides. Those two values are directly related to each other, and they're just completely separated in the medical world, and that's where heart disease comes from. And I can do a whole other video on this, but I just want to stick to diabetes today. So those are the old values. That is what you should be looking at. So if your blood sugar is over 100, you need to address it. But these new values, at being way over 120, 140, 150 even, they're not even addressing it. So you can't depend on your medical doctor to give you good advice moving forward about your blood sugar. What happens with blood sugar is when it's elevated over a period of time, that's what leads to insulin resistance. So your cells protect themselves from the constant bombardment of insulin in your bloodstream, and they become resistant to it. So they downregulate the insulin or hormone receptors. So insulin is a hormone. They downregulate the receptors to protect themselves. The cell protects itself from the insulin and becomes insulin resistant, not allowing any more insulin into the cell. So that's dangerous, because when that happens, eventually that's when your blood sugar can't ever be brought into the cell, and it keeps rising higher and higher and higher, and the number just keeps going up and up and up. That's when you'll become a type 2 diabetic. So the progression, if you don't change this, there's nothing good down the road. So I see it all the time. You know, we do blood work all the time in Atlanta Integrative Wellness Center. We take blood work first thing. You know, we want to see these numbers, because if your blood sugar is now at 100 or 95 or 100 or 106, next time, if you don't do anything, it's going to be 115, 120. And if you continue to not do anything, it's going to be 150 and 160. And all these things are going to come about. Like I said, you'll be diagnosed as type 2 diabetic. Worse than that would be a type 1 or an insulin-dependent diabetic. Worse than that is a double diabetic, which most people have never heard of, but you can actually have what they call double diabetes. So I don't want to get too far off tangent, because I want to give you basic information today so you can start taking control of your own health. So that's what we want. We want you to be able to control your own health and not depend on the medical doctor to tell you what's good and what's not good, because the information is just not good anymore. They're going to wait for a diagnosis to be able to be made and a medication to be able to be given for them to pay attention to it. They may tell you to look at your diet, but they're going to be going according to the American Diabetic Association. That diet is incorrect. It's not going to correct diabetes today. It's just not. You have to break the insulin resistance first and foremost, which is not what's happening. So the first thing you have to know is, do you have insulin resistance? Is it a problem? What is your blood sugar? So I'm going to do a series. I'm going to turn this into a series because when I started preparing for this video, the information is so overwhelming that the video would be too long. So today I just want to give you general information, and then I'm going to be sending an email out on Thursday to our group. So if you'd like that video on how to measure your blood sugar, what the correct number should be, please put below in this video in the comments, just put your email address and we'll add you to our email list. This way you can get that video, that email. So that will help you measure your blood sugar. So measuring blood sugar is such a simple thing. You just go to the local pharmacy, CVS, Walgreens, and buy a blood glucose reader. They're just about $10, and the strips are real cheap also, I don't even know, I think under 50 cents. And just get your blood sugar numbers. It's best to check your blood sugar levels first thing in the morning. So that's when you want to have your blood sugar number read, and then and you can judge where you are with your health. So what I wanted today's video focus to be is the danger of diabetes, because I don't think people are taking this seriously enough, because I do have people in front of me all the time with blood sugars at over 100, 120, and they're just not even fazed by it, but they may not know the dangers, so I usually share with them. So I just want to make a video and share with you the dangers of diabetes and what it can lead to down the road. So one thing with diabetic patients is they age rapidly, so you're looking at an early death if you're diabetic. 68% of diabetics develop heart disease. So like I said before, what's they work together is blood sugar numbers and triglyceride numbers, and then you couple that with inflammation in your body, and that's what's clogging the arteries. So there's so much misinformation out there about what's going on, but if you have high blood sugar, you probably also have high triglycerides. So you're looking at heart disease development. So you don't want that, of course not. So number 3 is that 50% of all blindness that occurs in the United States is in diabetic patients. So blindness is a problem. 70% of diabetics develop neuropathy when they can't feel, usually it's in the feet, they can't feel their extremities, and it leads to amputation. So this is all very scary to me. The good news is it's all reversible. So if you do go take your blood sugar numbers and you measure them and they're high, it's reversible at this point, but you want to pay attention to it. It's serious. It's a serious matter. You have to pay attention to it and take it seriously. You don't want to develop any of these further conditions down the road. So I will do a couple more videos in the next coming weeks to add to the series about how do you know if you're insulin resistant, how you can measure that, things like that. I'm going to send an email, like I said, to our group of people. So if you'd like a copy of that email, if you're not one of our patients, just put your email address in the comments below and we will send that to you. So you can learn how to measure your blood sugar numbers so you can take control of your health. That's what we want. You have to be in control of your own health.